Hi there. I would just like to take a moment and talk about the potential issues worksheet. This is a worksheet that you can use as you're going through your inspection. So we already spoke about the inspection criteria worksheet. That's where you will be using that to check to make sure that you do not miss anything as you go through your inspection process. Now, this sheet here has to do with if you find something wrong, how do you handle it? How do you approach the administrator or the director of nursing and say, listen, as I went through the inspection, these are some issues that I found. So I'll start out by talking about potential issues. So, for example, one of the number one most cited medication issues in surgery center is expired medication. And so it's important that you've been doing your due diligence, you've been checking medication monthly, you've been having the staff check medication monthly because you want to involve everyone. The more the merrier, as they would say. So you want to have a lot of eyes always checking those medications to make sure that we do not have expired medication on site. So if you show up and you find medication that's expired, you want to remove it from the area that you found it in and sort of set it on the side. And you will find out if they have any more of that specific medication to replace the expired medication. If they say no, and it's one that they do not use frequently, have them put it in a bag, identify that it is expired, and they're waiting on the stock to come in. That way, they're covered if one of the Joint Commission or the state shows up and sees the expired medication. They will at least know that the facility is aware of it and it could be on back order or they're just waiting for the stock to arrive. Um, so that's one way that you could handle that potential issue. If you find medication around that, let's say there's a bag of IV that's mixed with something and you don't know what it is, you would again bring that to the attention of the person, the director of nursing or the administrator, and let them know what you found. Not in an accusatory type of way, but in a way to be helpful. So, what I would say to them would sound like this. Hey, as I was going through the inspection today, I found a couple things and I just want to review them with you. And I would bring up the item and tell them these are the kind of things that facilities get cited for. And we don't want that to happen to our facility. And so these are things we need to pay attention to. Another potential issue would be a multi-dose vial that's not dated or it's past the beyond use date. So, for example, if they say that it was opened on the 1st and it should be discarded on the 28th, but now you're in the 15th of the next month and it has not been discarded, you want to bring that to the attention and tell them we need to be more diligent with this. And again, it's a teaching. You want to teach. You do not want to make it sound like, oh, you're messing up again. Because remember, our job there is in a consulting role. We are not necessarily, as long as we show up and help our facilities to stay compliant. That's why they hire us. That's why we want to be there to help and support them. And so if you find like you're going back month after month and there are multiple multi-dose vials and you're finding the same issue, you offer an in-service and you get the group together and say, hey, we cannot have this. And the administrator, that will go a long way with that because they appreciate when you help them to help their staff. That's so I hope this is helpful to you. Again, we're there in a to help them stay compliant. We're not there to tell them you're messing up. So I hope this was helpful.